I'm somebody who's managed a condition most of my life, and so have had a lot of touch points in this particular area, and also in a previous career chapter had the opportunity to live abroad. My family and I lived in Brazil for a number of years, and living abroad is an adventure, and there's constant learning. One of the things that stood out to me was the healthcare system. And anecdotally, I remember the first time I went to a pharmacy in Brazil, and I went to the counter and I passed over some scripts, and the pharmacist took a look and then said in Portuguese, "Okay, which ones do you want?" And it sounds a little mundane, but I had never been asked that before. And I think that's something that very few people actually are asked, period. But it has an interesting effect, which is that it puts you in the driver's seat. And all of a sudden now there's kind of a critical thinking discussion around which ones do I want and which ones are right for me. And interestingly, every time you go into the pharmacy there is a check-in on how things are going. And if things aren't going well, there's a discussion on strategies, common practices of other people dealing with the same conditions or taking similar drugs. And ultimately, options are available.
When someone is diagnosed with a chronic condition, there's sort of this trial and error process of which medications are best for that particular individual to treat their chronic conditions. And that process of finding the right med can be frustrating and time consuming for the member and for the prescriber, too.
One way that we think about it is the point of fulfillment. So if you think about somebody who demonstrates that they are a candidate for a drug as determined by the plan, they actually get that drug in their hand. That's the kind of place where Walrus begins to pick up and basically say, hey, this person says that they are, right for this drug, but is this drug right for this person is what Walrus can then pick up. And so if you see on the left, you see a lot of things that benefit teams very familiar with and put a lot of effort into constructing. And on the right, we get to that individual level where we have an opportunity to assess that. And the way that we can do that is by figuring out if they're getting the desired health outcome, how well somebody's tolerating side effects, if it's working well with the other drugs that are present, et cetera. And as we work through those issues, many people end up changing treatment. And Walrus also enables convenience around changes in treatment that help people move into other options that are available to them that are both coverage optimized and also the right drug for them personally. If you take a look at this chart, you're going to see about a quarter, 25% or so, of a typical population is on 5 or more drugs. If you split that in half, the group is on 8 or more drugs, with about 10% being at 10 or more drugs. So if you take people who are, who have chronic conditions, and you look at their total cost of care in the previous 12 months, you can see on this chart here that people who don't have RX issues are relatively, people that we could say are well managed. There's a relatively linear relationship as you move up in chronic conditions. So you see that, people with one chronic condition, 2, 3, 4, you do see an increase in the total cost of care amongst members who have these chronic conditions. However, when you go and you look at people that Walrus sees opportunity with, people who are on 5 or more meds, people who are clinically complex, this is what they look like in terms of total cost of care. And you can see that no matter how many conditions are present, that the people with poorly managed medications cost multiples of the same people who have several chronic conditions, but who are well managed. And so this is a way of understanding the value opportunity of putting Walrus in place with people who have poorly managed medications.
We can advance to the next slide. You can see members co-tracking side effects or symptoms, which helps us understand how a new or changed medication is affecting a member. And so while a member is doing any of those activities in the app, simultaneously, there's so much going on behind the scenes as their pharmacists ingest this information in real time using what we call the Pro Tool featured in the middle of this slide. The pharmacist also looks at RX and medical claims information and all the other information that we've gathered about that member to develop care plans and action plans to address the specific concerns of that member. And so you'll see that those simple thumb taps from the member result in clinical conversations with their personal pharmacists, which is really where the magic happens. So this is a 56-year-old female with depression, anxiety, and history of blood clots. She's been a Walrus member for about a year now. And so what you're looking at here is a summary of all that we've accomplished with this member in her first year of the Walrus Health Program. So I'm not going to go through each one of these activities because we could really spend a whole webinar just doing that. But you can certainly, read through the different types of activities to get an idea of how this member's conditions have become more well managed over time. But one thing I wanted to mention is there are a lot of programs out there that look at RX or medical claims and make provider or member outreaches based on what they see. But very few of those types of clinical programs develop a relationship with the member and get their input in the decision process, let alone through an app. And that's really the complete opposite of what Walrus does. So all the activities that you see here in dark purple could only be completed because the member was involved. And the only two activities that could have been completed with just looking at the data alone occurred in the first few months. So you see those in the lighter purple. But again, everything else wouldn't have been possible if this was a program that didn't connect with the member on an ongoing basis like Walrus does. So on the next few slides, I just want to dive into two particular interventions with this member so you can get a better idea of how the app helped us accomplish these activities. So this member takes a high-risk medication known as warfarin, which is considered a narrow therapeutic index drug. It's a blood thinner. And basically, there isn't a whole lot of wiggle room between a dose that's safe and effective and makes the blood just thin enough to avoid a clot versus a dose that can be dangerous and make the blood too thin, leading to some pretty serious bleeding. And so because it's a narrow therapeutic index drug, it's monitored regularly with a blood test called an INR, which tells us how thick or thin a person's blood is. And then their dose is either increased or decreased depending on what that value is. And so when we first started working with this member, she was not getting her INR checked regularly, and she was struggling with getting her INR within that recommended range, all of which you can see just a part of that conversation in the first screenshot. And so essentially she was taking too low of a dose or an ineffective dose, and we got her plugged back in with her hematologist and provided support and monitoring while her dose was increased. And now just a few months after that, her dose is perfect and she's responding exactly how she should be to protect her from a future clot while also not unnecessarily increasing her risk of bleeding either. Now, warfarin also interferes or interacts with a lot of medications. And so more recently, this member was put on an antibiotic that has a significant interaction with warfarin. And so during that time, we watched closely in the app for any signs of bleeding during that acute illness, which, thankfully didn't occur, but it's been really interesting to see this member come to Walrus when her medications are adjusted or if she's thinking about starting something new over the counter, because now she knows that warfarin can be a pretty dangerous medication if it's not taken correctly or if it's taken with the wrong medication. And so, of course, we'll continue to be that support and monitoring partner when these things arise as her conditions change. And then on the next slide, another impactful intervention we've completed with her is identifying a medication that was causing side effects and working with her care team to get this resolved. So essentially, she was experiencing some involuntary mouth twitches, and she didn't think it was related to her medications based on when it started, but I knew this was a possible side effect of one of her medications she takes for her mental health, the Vraylar. So I discussed this with her, and after that conversation, she met with her psychiatrist, and the psychiatrist's response to the mouth movements was to add on another medication called benztropine, which is indicated to treat mouth twitches. Now, mind you, this member was already taking about 10 other medications at the time, so now we're just adding another chemical to that mix, which of course has its own risks. But instead of changing the Vraylar to something else, the psychiatrist's original plan was essentially just putting a Band-Aid on a bullet hole instead of fixing the root problem. And so we worked with the member and her care team to discuss alternatives to Vraylar, and ultimately the member was switched to lorazepam, which is a preferred generic on formulary for that member. Lorazepam also has a less chance of causing those mouth movements and also less likely to cause weight gain, which I knew was going to be important for this member in particular.
What we are focused on is helping people to find what's right for them and within the context of the coverage. And, with that, you've got protocols from the drugs themselves, you've got the formulary and the plan design. And so when we are meeting with clients, talking about the opportunities here, part of what Walrus offers is a guarantee of a 2-to-1 ROI on drug cost savings. So what does that mean? It means that we measure the cost of drugs before Walrus and compare that against the cost of drugs after Walrus amongst Walrus users. We guarantee 2-to-1 savings on drug costs alone. Now, as we've touched lightly upon, there's a lot of medical savings that are available when people are on the right meds and when those meds are being properly managed. So there is a lot of value here, but we do guarantee 2-to-1. And about 10% tends to flow to the member, and about 90% flows to the employer or the plan.